Great. We can go ahead and hop into NCCARE360. So hello, everyone. Like Mary Stewart just said, I am Megan Carlson and Senior Engagement Manager for NCCARE360 and Unite Us specifically. So we will touch on Unite Us a little bit today. First, let's dive into what is NCCARE360. So NCCARE360 is the name of the statewide coordinated care network that is officially live in all 100 counties in North Carolina. We were slated to really go live in December of 2020 in all 100 counties, but we met that goal early, and as a response to COVID, we're able to have at least one organization on in every county in North Carolina. We achieved that in May of 2020. So very, very exciting. We started this work a little while ago now, in October of 2018, so coming up on the 2-year anniversary of this network. But as you can see here in this description, really the goal is to, with this statewide network, and the first ever of its kind really, which is very, very exciting and innovative, is that we are able to connect providers electronically by using one technology platform. A lot of these providers have already been working together in some form or fashion, but really this network and the platform itself appeals to them now more than ever because they're able to close the loop on referrals, know that their patients or their clients got where they needed to go, as well as be able to collect data for their organization and for the network as a whole. So we found that community partners are able to leverage this data, and we'll talk a little bit about that in a moment when we get to transportation, but really leverage this data to create action. And so that does kind of lead into these partners on the bottom, and these are the partners that are so critical and have been really necessary in making this initiative and this network a success. So starting with NCDHHS, or the Department of Health and Human Services, Dr. Betsy Tilson, Secretary Cohen have been very instrumental in making sure that we are continuing to make the right connections, specifically with our health departments, our DSS agencies, our voc rehabs, because we find in each and every county, those key organizations are necessary to get other community-based organizations to join, and they've been able to really provide guidance to those specific DHHS departments to get them excited about NCCARE360. A large part of this initiative over the past 2 years has been a lot of word of mouth to get organizations excited about this. So DHHS is the public piece of the public-private partnership that NCCARE360 consists of, and the private piece is the Foundation for Health Leadership and Innovation over there on the left-hand side of the screen. So the private piece being that FHLI is the acronym, is the fiduciary agent, meaning that that is where the funding for this initiative is coming from. The reason why community-based organizations are able to access this network at no cost is because of the funding that's been implemented and in place and sustainable by DHHS and FHLI. So along with those two key partners, we do have on the end there United Way of North Carolina and NC211. So United Way of North Carolina, as most of you know, have been able to have quite a footprint in each and every county, or counties in North Carolina, but then also working closely with NC211. What they did was actually kind of amazing. And so 211 exists as it always does. For those of you who don't know, a community member can call in anonymously to request assistance. Well, what they also did now as part of NCCARE360 is hire specific NCCARE360 navigators to then take calls and refer individuals through the platform. So that's been really exciting. They also take referrals from our public-facing assistance request form, which is on NCCARE360.org. So that is a way for someone in the public to essentially refer themselves into the network, because the network is provider-facing otherwise. But very, very critical 211 and United Way of North Carolina. And then coming up on the second to last, Expound. Expound is the sort of data gurus who have been able to take multiple resource directories from across the state and really centralize them and integrate into one public-facing resource directory, which is on NCCARE360.org as well. So along with Expound, the final piece is Unitas. So as you all recall, Unitas is my direct employer. So Unitas provides the technology, the web-based platform that organizations log into in order to send referrals and or accept them. Unitas also has invested in on-the-ground local experts, community engagement managers like myself and my team. That's worked with each and every county. Back before COVID, we were going in person to a lot of these counties as well to be able to share more about NCCARE360, provide a demo of the platform, and really help organizations learn about this initiative and how powerful it can be to be connected. So that's a broad overview of NCCARE360. We'll hop into it more, especially as we dive into employment and transportation, but this network could not continue to function, would not be healthy without now we're at over 1,500 community organizations, health systems that are a part of this network. And so it's been really exciting, and we only continue to grow from there. So now we can hop into the next slide if you'd like. So NCCARE360 and employment. So within NCCARE360, we have 5 main pillars, and these are organizations that we'd like to have represented on the platform with, mind you, the ultimate goal of really addressing the social determinants of health. And those pillars are housing, employment, food assistance, interpersonal violence, and transportation. So you'll hear us talk about 2 of those today, but employment is considered one of the key pillars because it is so necessary to an individual's well-being. We know that the majority of someone's health occurs outside of the clinical setting, and so those social determinant of health pillars really do play a key role in making sure that someone is living a happy and healthy life. So within employment resources in Eastern North Carolina, I have the privilege of working predominantly in the eastern part of the state, being from Carteret County for a large majority of my stay here at Unitas. And we were able to find local NC Works locations, specifically in local community colleges that could provide and were willing to come on board and provide some sort of employment assistance. And when I say that, employment providers come on and they select a variety of services that they're willing to receive referrals for. Often that would be resume assistance, job training. There might be some interview coordination as well, but these providers are coming on and not necessarily providing direct employment opportunities, but at least connecting someone to that opportunity. So along with NC Works, we also have pretty active Goodwill locations in North Carolina that we're also able to connect individuals, and that's actually where one of our examples comes from today. And then additionally, we'll have local vocational rehab locations that are able to connect individuals as well. And so that's been predominantly the experience that we've had. We've worked at a statewide level, at least with NC Works, trying to get a sort of uniform approach to getting these organizations on. But there are a variety of organizations out there that don't sound like they're employment providers or assisting with employment, but they often are. They're sort of that connector in the community that knows the right provider. And so we lean on those types of organizations as well. But in terms of how NCCARE360 can really help impact employment, I think now more than ever, especially in a response to COVID, we have seen our employment referrals kind of skyrocket a little bit. And that makes sense, right? As a result of COVID, a lot of organizations had to sort of trimmed down to a skeleton staff. They had to learn how to operate more virtually. And as a result, individuals did lose their jobs. And that combined with the sort of eviction and housing crisis that we're facing, you're seeing employment rise, you're seeing food assistance rise, and it's all sort of happening at the same time. And so the network has provided a good net for organizations to be able to find a multitude of resources. And additionally, what our team does is seeing how many needs are arising. We're continuing to reach out to employment providers to onboard them as a response to that. We want to make sure when a provider logs in and needs to send a referral for an employment case on behalf of their client, that they can find the appropriate organization to actually send to. And so that's been a huge focus of ours as well. And we'll talk about that with transportation, but specifically with employment, this is sort of the call to action here. If there are any employment providers that you all know of or that you could connect us with, we would be happy to reach out. That's sort of our job now, is to continue to provide presentations like this and get more organizations onboarded, and we'd be more than happy to facilitate those conversations in a response to our community. So that is the long and short of NCCARE360 and the employment overview.
Thank you so much. And as a note to all of our participants, in the same platform that you registered for today, you have access to the partner form and how to become a partner with Unitas and NCCARE360. And so that is a resource that you have at your fingertips as a part of the resources from today's event. As a quick announcement, I did want to ask if you called in with a telephone number that's associated with another name that you may be registered under, or perhaps you're using a different name on Zoom today than you registered under, if you'll please send us a private chat of the name that you used to register. That way we can accurately have you listed for credit if that was a desire that you had. And now I'm going to shift it over to Shannon for our case.
Hey guys, I'm sorry I was on mute. I'm Shannon Peden. As Mary pointed out, I work for Eastern AHEC on the practice support team. And I got a really cool job today because I get to share a really neat success story, an employment success story that's actually coming out of Goodwill Industries of Southern Piedmont. This particular case, the team over at Goodwill was working with a Mecklenburg County veteran. This veteran was in the process of moving into a new home, and she really desired to become a little more financially independent. She had previously had some property management experience, but she had also had to rely on government benefits a little bit. And with her new home, she really wanted some more financial independence. So the team at Goodwill assigned her a case manager in the Goodwill organization. They were able to meet and find out that this client also had more interest in more job training opportunities, things like that. This case manager was actually able to help her begin to build a resume, get things down to try to, find this job. So the two of them worked as a team to comb through all of the job listings that they had within 360. And within 3 days, it looks like she has a scheduled interview. And this particular job has benefits. They have more reliable hours. And the really cool thing is this is like an in-process case as we speak. So this case manager is actually set to follow up with her this week and figure out hopefully how that interview went. And we all hope she got it. And that's it, Mary. I'm going to turn it back over to you guys.
Great. Megan, will you give us our intro for transportation and how NCCARE360 is bridging that gap?
Sure. So transportation has been, specifically in Eastern North Carolina, has been definitely a interesting area to tackle. And I think we all know that there's sort of a lack of transportation resources in not only Eastern North Carolina, but in most of the rural parts of our state. We don't have the public transportation that places like Charlotte and Raleigh may have. And so it usually is local transportation service providers that I've worked with in Randolph County and Beaufort County to try to connect individuals to transportation. And so that was something, you know, and I mentioned earlier that transportation was one of our main focus areas when we did first start this initiative. And we sort of found out very quickly that there were not only not very many transportation providers in the area, but that most sessions that we went to, most community-based organizations knew that. They, you know, would tell us sort of up front that, you know, you can try to find transportation providers, but it's going to be hard to find some. And so we sort of looked at that problem. And I remember talking to Caroline Doherty, one of my connections at Roanoke Chowan Community Health Center, and we said, okay, well, how can we use this network to help provide some concrete data around that? And so the solution that we then came up with was that we wanted to encourage organizations to make transportation referrals out of network, and that's an option that's in NCCARE360. An out of network resource is one that's listed with 211, but not necessarily listed or has registered to join the platform yet, right? So what we were then encouraging organizations to do is refer to those organizations out of network, show that you at least have a transportation need. And then we encouraged organizations that if there were no out-of-network organizations to pass along referrals for, let's just note that in our case notes somewhere. You know, needed to refer this individual to a local transportation resource, but was not able to find one. And those notes can be downloaded and exported. And so that's the type of data that when we think about the state, DHHS, that we know exists, right? Anecdotally, we may know that there aren't very many transportation resources, but how can we prove that through data? Prove that I would have made, you know, 40% of my referrals this year to transportation because my clients needed them, but there wasn't anywhere for me to actually send them. And that's the important piece that we're able to capture through NCCARE360, especially in the areas of our state where we could use more transportation resources, more funding to go towards that. Similarly, in a similar vein, in the rural parts of the state, we've been told, well, our internet access is not very reliable or dependent. So we can't use something like a Lyft or an Uber, or it's not available in our parts of the state. And so that's something that working with DHHS and some broadband providers that we're also investigating. And so that's sort of sums up the power of data and this right collective community voice to say, this is a resource that we need more of, and we need help directing funding towards it, right? But within the transportation providers that are on the network, we typically will see there are some large-scale transportation, mass transportation providers that have some one-off programs that they can receive referrals for. But as you all probably know, most transportation providers don't necessarily need to receive referrals in order to enroll someone in a public transportation service. So it does sort of look more like ride coordination to medical appointments, specifically within Medicaid. If we can find a Medicaid transportation provider, that's an organization that is easier to onboard, and most communities, urban or rural, will have at least one of those. And so that's been a large part of our focus as well. And then in terms of the type of usage that we see around this, ride coordination to medical appointments is one of the higher requested services, and that is something that we've seen a provider that's looking to not only make an appointment for someone, but then they're asking the questions that are really necessary as a follow-up, right? I can make you this appointment to go see your primary care provider, but then the most important question is, well, do you have a way to get there? And so in NCCARE360 and Unitas, we have Builtin Assessments, which is a series of questions that come along with these referrals, and there is, and they're optional, but it's included in that referral workflow. And so that helps a provider ask the right questions, right? The questions that may not be on the front of their mind. And within transportation, it is, so you need a medical appointment. Okay, great. Or you need a ride medical appointment. Okay, great. Well, what day do you need that ride, right? So you're coordinating some logistics there to send to the hopeful transportation provider. It also asks, do you need help with childcare? That's something that we may not have thought about initially, but if someone is needing a ride to an appointment, right, do they also need to bring children with them, or do we maybe need another referral for something for childcare so that they can go to that appointment? It's all of these dependencies that we often don't think about, but that is sort of built in to the referral workflow to make sure we're screening and connecting someone with the more appropriate resource. And so those are really the crux of what we see in terms of transportation. We, like I said before, would like to work with and approach this with a more statewide approach to see if there is a provider that's operating across the state that we could coordinate with and onboard more providers with. I will say Unite Us, so the technology provider in other states, does have a Lyft partnership. So for those of you that aren't aware, Lyft, similar to Uber, is a rideshare service that can connect individuals to a local Lyft driver near them. And so that has been something that we're wanting to actively explore, especially in the rural parts of our state. If we can sort of tackle the broadband issue and access to internet, I think that would be very powerful. I mean, if you think about Lyft, Uber, any, DoorDash, Uber Eats, any of these sort of companies, what they're doing is employing. Not only are you addressing employment, but you're also addressing transportation with something like that, right? If you can employ an individual at whatever schedule that they can work to then drive other individuals around wherever they need to go, I mean, it's quite a helpful model to address and sort of tackle two separate issues at the same time. So I think that's something that, as we continue to build out our technology infrastructure, right, those drivers need access to internet. And so if that's an issue in the community, that's going to be hard to address. But I do think it's an interesting model to consider moving forward. And so in terms of any sort of programs that you all may know of around medical transportation, transportation for Medicaid recipients, and even transportation that may cost something, that's also something that can be noted in the profile of that organization. So when an organization is sending someone to that provider for transportation, they're aware of maybe this requires someone to be a Medicaid recipient. This maybe requires someone to pay a small fee up front. That's all something that can be communicated to the client so that they can make the best decision for themselves. But very, very interesting to see the progress that we've made throughout this time that NCCARE360 has rolled out, that, bringing up these issues, bringing up the lack of transportation, the need for more local food pantries to address hunger. It's been something that has been really powerful as we've continued to roll out this initiative, and hopefully will continue to be really powerful later on. So that is the crux of transportation.
All right, so now we're going to discuss a case, and then we'll probably have plenty of time at the end, which was good because last time we went over, people had lots of questions about how to get onboarded, how can they get this information out to other agencies in their networks within their counties that weren't able to join us today. So Megan will be able to answer all those questions for us and how to get involved and how to get plugged in. But first, we'll go through this case study together about transportation. This is a success story out of Stokes County, and it is a perfect example of how NCCARE360 is creating bridges in rural North Carolina. So this is a referral to a social worker, and she's a dementia practitioner with the Triad Health Care Network. And here is the story as told by the social worker at that agency. I received a referral from a patient who lived in Stokes County. She had just been discharged from a 30-day inpatient stay. This patient was in her 70s. and lived at home with her husband. She suffered a femur fracture, which is what led to her hospitalization. To hear the husband tell the story, this patient had no idea she was sick, and one day she collapsed with a fracture in her leg. This fracture led to the hospitalist to realize the patient had stage 4 bone cancer. After undergoing an orthopedic surgery, she began chemotherapy and radiation. Upon returning home, the patient would need transportation assistance from her home to cancer treatments in High Point. This patient's husband could drive the patient, but was scared that how he would manage getting her in and out of the vehicle because of weakness after the surgery. This social or NCCARE360 training and how to use the platform in network and out of network. Out of network is similar to a resource directory with a full list of resources that were not yet established on the platform, whereas in network are partners that are a part of the platform. A resource was located and they contacted that resource that day. It's a resource similar to a countywide transportation agency. However, they, instead of just servicing certain parts of the county that are maybe more metropolitan, it services the entire county and the entire Yadkin Valley. So nooks and crannies and rural communities in that neck of the woods in North Carolina. It provides some out-of-area trips within the Yadkin Valley as well. They also provide mobile meals. So this social worker was able to get the patient established with mobile meals within 1 week. And spoke with the representative regarding the patient's transportation needs and was informed she could also receive services. And after discussions with patient health about the patient's health condition and appointment type, transportation fees were negotiated down to less than $10 round trip. This particular number was way less than the original quote, which was an astronomical amount for this patient. And it also expanded the reach of this service to include the ability to serve her husband and give him access to the services as well. So without NCCARE360, there wouldn't have been mobile meals and also transportation to these appointments from very rural parts of the Yadkin Valley area. So what social determinants of health, I like to use the chat box. It kind of makes things a little bit more interactive for folks that are on the other end of this line. So what social determinants of health were addressed in this case? We did a little bit in the debrief portion after I went through the case, but put in the chat box what social determinants were addressed. I think you have my notes, Courtney. And Hannah, thank you so much for filling in the gap here. You're exactly right. So transportation was, of course, addressed, food insecurity, but definitely disparities and the health of this patient overall, getting her to and from appointments. I think there's also significant merit in that the services were then expanded to include her husband, to include his care and his transportation needs in this case as well. So wow, we've got lots of different answers in the chat box. Thanks very much for keeping things interactive. So now we'll kind of open up the floor for some discussion. Please put any questions you have about NCCARE360 as they pertain to employment and transportation. That's what we're focusing on today. If you know of any employment agencies or transportation agencies that may or may not be a part of the network and you want to learn a little bit more about them, or perhaps have access to the platform. I'm not sure if Megan would share that in the chat box with all panelists and attendees, but to put the link out for folks to get a little bit more information or to find the current listserv of folks that are in their region within that directory, that may also be a great place to start. But just to start the discussion, if you guys have any questions, please put them in the Q&A box. That way we'll keep it separate from the chat. And as they come in, I will list them out to Megan to hopefully get us some good information about how to get plugged in. So we'll give that a few moments for the chat box to catch up, or the Q&A box. So Megan, we have a question in the chat. Is NC Works a part of NCCARE360? Have they been a part of the loop?
Yeah, so that's a great question. That was one of the employment providers I identified at the beginning. They've been a great partner. We've essentially worked with them at a county level. As we were going county by county, we would encounter the local NC Works and attempt to get them on board. And like I said before, usually located at the local community college if they didn't have their own building. And so that was a great connection for us as well, because they were providing much needed services to the students there. And that was something that we wanted to take advantage of. So yes, NC Works has been a great partner.
We have another question that's just been added to the Q&A box. Who or what can actually make a referral? Is it only healthcare professionals, or can it be other folks who are in that partnership network?
Yeah, great question. So the individuals that can make a referral are any organization that is a part of the network, meaning that they have joined via the registration form, they've attended some form of training, they have a login to the platform to make a referral on behalf of a client for a service that they may not be able to provide. So yeah, it's individuals, organizations that are a part of the platform itself.
Our next question, what is the turnaround time between requesting the assistance and receiving a response to close that loop?
Yeah. So the data has shown us, and specifically around one of our first networks out of Charlotte, that we were able to take what was usually, because it's a manual process, the time to connect an individual to services, it was usually around 7 days previous to the organizations using Unida. And we were able to take that down to a 2 business day turnaround. And in fact, that helped inform some of our network standards. And that's what, we're not asking organizations to pay for anything by joining, but we are asking them to be a responsive partner in the network. And so part of that means that if you've been sent a referral, right, you get that email notification. It is in our standards to respond to that referral. Yes, I can help, or no, I can't, within 2 business days. And that ensures that the network continues to stay healthy.
Awesome. We have another question that's just come in. Have the county DSS offices and health departments joined NCCARE360 to have access to resources for patients and clients? So have all health departments and DSS offices been onboarded, or are you still kind of trickling those in bit by bit?
Yeah, so we have across the state around 70 that have continued to join. There's a few stragglers out there, and specifically we're working closely with, and I can say that's health departments, DSS agencies took a little bit longer because they have very specific and protected programs. So DHHS is actually in the process of developing guidelines for DSS around which programs make sense to come on board. But specifically with the health departments, many of you are probably familiar with the community health workers work that's going on right now, and a large number of the community health workers are sort of situated at those health departments, and so that's helped bring in more health departments onto the network because DHHS is using NCCARE360 to track the CHW and support service vendor work across the state.